most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heine, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course.
Today, we're going to talk about neck pain, pinched nerve, how to know if you're doing the right neck exercises or stretches.
Sure.
This is very important because if you're doing the wrong one, it can make it worse.
Absolutely,
So-
and set you on the wrong direction quick.
So the common causes of a pinched nerve in the neck are you could have a disc problem, you could have degeneration of the bones and to the point where they make the holes smaller where the nerves come out.
Sure.
You could have thoracic outlet syndrome. And that's where you're getting pinching between the collarbone and the first rib.
Right.
So, and you could also just have compression from muscles
Right.
in your neck. So
And there's more, but
there's more, yeah.
we don't need to bore you.
That's right. So neck pain can vary in location and intensity. It depends on your diagnosis and your age and your posture. But the common locations are, and we got them kind of.
We mapped them
here.
out.
We mapped them out. This is for a pinched nerve, but it's very common to have neck pain, of course, up in the neck itself. But then you can also, Brad, do you want to show out some?
Sure. So we have a lot of people may not be aware of this, but oftentimes there's something called referral pain. The pain refers down to the shoulder blade area. That's very common. It can come over this way onto the shoulder, as the blue tape shows. And then if it's a nerve and it's pinched pretty bad, it's very common that it's going to go down the arm. Now, it may be in the front of the arm. Not always in the back like we have it here, but down the arm and down all the way to the wrist and actually up into the fingers. And that's where neck problems and carpal tunnel can cross over symptoms. So that's something we have to be careful of.
And it can also be, did you say between the shoulder blades too, Brad?
Yeah, we don't have a piece of tape for that, but yeah, it could radiate down into or refer down between as well.
So those are the common areas. And if your pain is getting worse, it's going to go further down.
Right.
That's pretty much a rule of thumb that can be relied upon.
Pretty universal.
Yeah. So like if you just have shoulder pain and it keeps referring down the arm, that shoulder pain is getting worse.
Right.
If you have just regular neck pain, not even a pinched nerve, but the pain is going further down the arm, it's getting worse.
Yep.
So
Yeah, so if you're stretching your neck, and maybe the neck feels better, but the arm starts to feel worse or it goes down the arm, that's a big red
That's a
flag.
bad sign.
You need to
So
stop that.
what we're looking for is that your symptoms are going to improve the farthest away,
Right.
where you're feeling. So like if I'm getting symptoms all the way down here into the hand, what I want to see is the hand gets better first.
Yep.
Now that could be numbness or tingling or
Sure.
burning or whatever. But if you do the exercise, you go, oh, there's a little bit less burning there.
Yep.
Or just a little bit, I can feel it now.
Right.
Yeah.
And you really have to be aware of it before you start your stretch. I always have patients put a number for intensity on the pain and numbness in your hand and fingers right now. They'll say a 6, and we'll do some exercises. And sometimes they have to think about it. Oh,
Yeah.
that's down to a 3 now. So, or if it's getting worse from a 6 to an 8, well, then we're going to stop that exercise.
It's a good point, Brad, because people forget.
Yeah.
And it may even not happen the first day.
Yeah.
They might do the exercise for a couple days, and then they go, yeah, I can't remember if it's better or not. But if they go, it was a 6 and now it's only a 3, you're telling me. So
A good thing is sometimes it's like, oh yeah, I forgot I even had it.
Right.
When it goes back to normal, your mind kind of forgets where it was. So writing it down on a calendar or a piece of paper
this
is a really
the
good
time
idea.
where it's really good to chart.
Yeah.
So as it gets better, you're going to see the pain hopefully improve as you move up the arm. We actually have this tape so Brad can show improvement here.
Yeah.
So
So Bob has these symptoms and he starts to stretch his neck in a certain way. And this is what happens the next day. The pain, the blue represents where the pain or the symptoms, numbness, tingling are. And let's say it gets this much better. All of a sudden, oh, this part's gone, but it still hurts here. And maybe even a little worse up here. That's actually a good sign because it's getting better. We call it distally or farther away from the neck.
yeah, and the thing is, this could happen the same day even.
Oh, I've had it happen in the treatment room.
Yeah. So it might be a couple days. It might be the same day.
Right.
Either way, you don't want it to get worse.
We don't. Yeah, we don't want it to come back. Let's
Yeah.
say it gets better, but then the next day it returns.
Or the next day you do an exercise and it causes pain down in
Yeah,
there.
that's a negative thing.
Right.
You don't want that.
So yeah, let's say you come in and you see me and you're like this,
Yep.
and we start doing exercises, and all of a sudden you have pain down here too.
Yeah.
That's the worst sign.
Yep.
That's
Then you got to stop and
yeah,
change exercise. And that's what the therapist, that's our job, is to get to the right exercise. It's just not
Right.
a global thing. And so let's say we get to the right exercise and all of a sudden, voila, oh, the arm pain is gone.
yeah, the numbness, the
But it
tingling.
hurts a little more up here possibly. But the arm pain, the numbness, tingling is all gone.
Very good sign.
You bet.
This is-
I'm smiling as a
yeah,
therapist.
now we're happy.
Yep.
Doesn't take much to make us happy, but this makes us happy.
And that's nice. A lot of people say, I thought it was a bad sign because my neck hurts, but the arm
Right.
is better. And then you reassure them, oh, this is good. People relax and things start to
Yeah.
improve even more yet. Do we want to continue?
Sure, let's continue.
You keep doing this. A lot of times it's the same stretch. Sometimes it has to be modified. And then the shoulder pain goes away, and we just have a little bit here. And I'll have patients while they're doing the exercise, they can feel the pain dissipate.
away, yeah.
Yep. And those are the easier ones, and not all, everything is this easy, unfortunately.
Yeah, it's when it does happen, it's nice. It's kind
Yeah.
of like the miracle in the clinic.
Yeah, it's fun then. The patients think you're God.
Yeah.
And then we continue, and when it comes down to is just pain in the neck here, boy, and everything else is feeling good. That's a really good sign. You continue to work it, and eventually,
Boom, it's gone.
Yeah, boom. Wow, you feel much better, aren't you,
I'm
Bob?
feeling great. It's funny you brought up that story about they think we're God or whatever, but obviously we're not. But when I did one of my first rotations as a student, I got this patient,
Yeah.
and she just got better really well.
Yeah.
Better. And so my CI, my instructor, clinical
Right.
instructor, said, "Oh, your disciple's here," because she just would go on and on about how I made her better. So
Yeah, boy, it was quite a boost as a student.
yeah. Well, the other story I have is real quick. My mom had to go into a nursing home and get some treatment.
I know
And
this story.
You know this story, and she goes, "You guys are like Jesus.
Yeah.
I mean, you take care of the sick and you make people better." And
Yeah,
So
that's going a little.
that's
overboard.
going a little far. So. This video, by the way, is a part of a series of videos on neck pain. If you want to see the whole series, hopefully we'll start. It's got to be. They have to all be uploaded, so it's going to take a while.
Right.
But go to bobandbrad.com. Go to the program section. There's other programs there, by the way.
Yes.
And you'll find the one on neck pain. Watch the videos that you just want to watch that are pertain to you,
Right, just go by the title.
and check it out. And
The PDF printout is
Yeah.
available for each video. Shows a review of the video, exercises, a list of highlights we went through. There's nothing required for you except for a smile and good luck with it. No email or anything.
and we got future videos that are going to show the exercise that hopefully is going to work for you.
Sure, exactly. Yeah,
so-
we won't cut you off.
All right, check it out.